Okay. Yeah, I know.
All right. Senate will please come to order. Senate will please come to order. For today's devotionals, we will gather in silence in lieu of devotionals. Thank you. Let me just confirm the transportation bill is 868, correct? Okay. We have, are there any announcements? Seeing none, on behalf of the Committee on Committees, I'd like to appoint the following folks on H868. Conference committee was requested, and the following senators will be the committee: Senator Perschlick, Senator Chittenden, and Senator Ingalls. We have one bill for referral under Rule 31, that's H630. H630 affecting the expenditures of the state will be referred to the Committee on Appropriations. I believe that brings us to the orders of the day. Our first order of the day is S25. Melissa, the clip is falling off, so I just want you to know that's delicate. S25 passed the Senate. The House also passed it with proposal of amendment. Is on your calendar under the question, shall the Senate concur with the House proposal of amendment? I believe there is a motion from the floor, and therefore the senator from Chittenden Southeast.
Thank you, Mr. President. S25 is the bill relating to regulating cosmetic and menstrual products containing certain chemicals and chemical classes, textiles, athletic turf fields containing PFAS substances. And so as if you recall, this bill was passed from the Senate last spring and now has returned this spring. So it's been a bit of a time. So I don't expect that most of us will remember the content of the bill. What I'm going to do is to go through the further proposal of amendment and acknowledge the work that's been done by the other body, and to let you know that in a 5-0 vote, the Committee on Health and Welfare will ask that you support our further proposal of amendment. So I'm sorry, I don't have the page numbers for you. I only have the page numbers for myself, but I'll try and direct you to the sections as I go through. First of all, the biggest change that was made in the bill as it came to us from the other body is a movement of the regulation of these chemicals and the inclusion of these chemicals and products from Title 18 to Title 9. So that would then place these chemicals and products under the Consumer Protection Division, and then it would include the enforcement provisions that we have emphasized in with our committee. So you'll see in the first section, it's now 9 VSA, it's no longer 18 VSA. The other thing that the other body did was to identify chemicals and products, but also to list consumer products that then would be protected from having significant toxic chemicals. Go to page 5, and I hope I can tell you this section. I'll try to make this quick, Mr. President, but in 2494C, you'll notice there is a section on violations, and it adds in consistently through our proposal enforcement provisions that are in Title 9. And that happens in various sections of the bill. And then later on in the bill, for me, it's page 26. I don't know what page it will be for you. But it is section 9, and section 9 is relates to what the other body did was to include S197, which is a bill that we passed out of our committee this year, and it asks for the Agency of Natural Resources and others to look at and bring to us a proposal for a more general regulation of PFAS, and to have a better definition and to understand how we might put all of these chemicals into a regulatory program. Then our proposal of amendment really included the addition of the enforcement dates that I've mentioned earlier. And then at the end of the bill, section 12, we have taken out a section that was in the House proposal. That section recommended a level of lead in cosmetics of 10 parts per million. We took a lot of testimony about that, and we have taken that section out. And rather than have a specific number related to lead in cosmetics, we've added a short update on what's happening in the state of Washington. They have a law that reduces lead content in cosmetics to 1 part per million. And current FDA regulations are at 10 parts per million, and we have decided to leave that FDA guidance in place. So that's our proposal amendment for that section 12. And then in section 13, we've moved athletic turf into a newer timeline to be effective in 2026. And I believe that is it. So the work that the other body did is work that really consolidates our efforts in identifying chemicals and products that contain those chemicals and restricting their manufacture and sale in the state, as we have looked at those in the past, including PFAS. Our further proposal amendment is to include their further proposal amendment is our bill on 197 to have a more comprehensive plan for PFAS regulation. So overall, your Senate Health and Welfare Committee concurs with what the House has done with our very few changes to the bill. And we would ask that you also support us in that effort. Thank you, Mr. President.
So the question is, shall the Senate concur with the House proposal amendment with further proposal amendment on S25? Are you ready for the question? If so, all those in favor, please indicate by saying aye.
Aye.
Those opposed indicate by saying nay. The ayes have it, and you have concurred with the House proposal amendment with further proposal amendment on S25. It's my understanding we're passing over H534 and S30, which would bring us to H72 in your calendar on page 3286. H72 is read for the first time and referred to the Committee on Health and Welfare, which considered the same and recommends that when the bill is amended, the bill ought to pass. The bill is then referred to the Committee on Finance, which also recommends that when amended, the bill ought to pass, and was further amended, it was then referred to the Committee on Appropriations, which also indicated that when amended, the bill ought to pass. Please listen to the second reading of the bill.
H72, an act relating to a harm reduction criminal justice response to drug use.
Now you've heard the second reading of the bill. For the report of the committee, the senator from Chittenden Southeast as well.
Thank you, Mr. President. We know that Vermont substance misuse in municipalities and neighborhoods continues. Local residents have found used needles near schools. Friends and families are severely affected by the loss of loved ones from addiction or death. And some people are so intimidated by drug distributors that they're leaving their apartments or made to live with drugs being sold in their homes. Overdose deaths in Vermont in 2021 totaled 217. 2022, that number went up to 244. In the first 9 months of this year, 180 deaths were reported. These are preventable deaths. This is an unacceptable trajectory. As long as there's demand for addictive substances, these problems will persist. And there's not one solution to bending the curve on addiction or the demand for opioid and other addictive substances. H72 will allow for the establishment of a safe haven for those with addiction at overdose protection centers. The Vermont Department of Health has a public service campaign that tells Vermonters struggling with substance use disorder, never use alone, because doing so greatly increases the risk of fatal overdose. H72 directly addresses that concern. H72 creates a state legal framework and guidance process for overdose prevention centers, allows for a pilot project in Burlington, and commits to robust research and evaluation of the pilot. As for some of you, and I know that many of you in this body think of this as a controversial topic, and I have been with you for a long time. I had my reservations as this issue was discussed over the past 7 years, but now we have a robust body of research finding multiple positive effects of overdose prevention centers and no negative ones. It's time for us to move forward. Senate Health and Welfare listened to hours of testimony from a variety of voices about how best to respond to an opioid epidemic, that sadly has led us to the loss of over 1,500 Vermonters between 2012 and 2023. It's a shocking 500% increase over a period of time. These heartbreaking numbers constitute human lives, our children, our friends, our coworkers, fellow Vermonters in our community. And we know, according to the Vermont Department of Health, that most people who overdosed did not have a bystander present. Never use alone, and we will save lives. Our committee received letters from across Vermont, one of which was from a physician who lived in my district and works in the field of substance use disorder, and in 2017 tragically lost her son to an overdose. Mr. President, may I quote from her letter?
Without objection, you may.
Thank you. Dr. Kimberly Blake writes, quote, "I have seen how our government responded so favorably to the COVID-19 pandemic. At the time of our son's death, fentanyl had been widespread for over 2 years. I only wish the opiate crisis had received half the attention that the COVID-19 pandemic has received. We are losing so many young people, and no one can recover from substance use if they die of an overdose." Dr. Blake goes on to say, "The science tells us that overdose prevention sites save lives, reduce syringe and paraphernalia litter, and connect people to treatment. I have visited such sites in Canada and found that they are clean, clinic-like atmospheres with warmth and caring staff. I know Vermonters are very compassionate, and I hope we can expand this compassion to those with who use substances, end quote. Our committee heard testimony, examined research, and importantly, we heard from those with direct experience. We learned that overdose prevention centers save lives and have an important role to play alongside prevention and treatment. This is a huge part of public health efforts addressing our opioid crisis. The testimony and research showed that there are no recorded deaths at overdose prevention centers worldwide. Studies show the reductions in overdoses when OPCs are used. Research also shows improved public health outcomes for participants, such as reductions in infectious diseases, staph infections, and endocarditis, which is a deadly and costly heart condition that can impact people who use drugs. The research shows that overdose prevention centers are effective pathways for treatment, especially for those who are resistant to accessing the treatment system on their own. Studies also demonstrate cost savings for emergency medical systems because of reduced EMS calls, reduced emergency room visits, and diverted hospital stays. And just as an example, the avoidance of one case of endocarditis can save between $100,000 and $600,000 of dollars, depending on the severity. And that's according to the President and Chief Operating Officer of UVM's, our largest hospital. OPCs also provide significant community safety benefits, including reductions in public use disorder, reductions in public drug use, disorder, and discarded paraphernalia such as needles. Research shows that all these positive benefits occur without increases in drug use or crime in the surrounding areas, without initiating people into drug use, and without attracting new drug users to the area. We're proud in Vermont to often lead the country in innovative strategies for public health. But on this issue, we have the good fortune of benefiting from the experience of nearly 200 overdose prevention centers in over a dozen countries around the world, including the United States. After passing a similar bill to the one we are considering now, Rhode Island is set to open an overdose prevention center this summer. Last year, Minnesota authorized funding for overdose prevention centers in their state budget. And in New York, a nonprofit, On Point, is operating 2 overdose prevention centers through agreements with the city's police department, health department, and multiple district attorneys. And since they opened in 2021, evaluations of the site have mirrored the research that shows that there was never a fatal overdose at the site, and emergency medical services were rarely needed. Public drug use, needles, and paraphernalia were diverted, and 75% of participants accessed harm reduction, social, and medical services. That's significant. Recently, the Massachusetts Department of Health endorsed the establishment of OPCs in their report. Mr. President, may I quote from that report?
Without objection, you may.
I quote, "Faced with the urgency of the overdose crisis, OPCs represent an evidence-based, life-saving tool that is aligned with a comprehensive public health approach to reducing harm and improving well-being in the Commonwealth, Massachusetts. OPCs are also well supported among people who use drugs, agencies, and staff of existing harm reduction programs, and a majority of Commonwealth voters. After considering existing resources and capacity, Massachusetts Department of Health believes that OPC establishment is feasible and necessary, pending legislative action to extend legal protections, and recommends that OPCs be pursued as an additional tool to address the harms of substance use. And that comes from the feasibility study of Massachusetts, December 2023. Recently, the Board of Health for the town of Worcester, Mass. Voted to support the idea of moving forward with an OPC pilot. The actions taken in Minnesota, Rhode Island, New York, Massachusetts are consistent with a growing support from public health groups for OPCs, including the Vermont Medical Society, the American Medical Association, the American Society of Addiction Medicine. We have either taken testimony or heard from numerous medical and harm reduction providers that OPCs are a necessary tool to help save lives. We also heard in testimony that Burlington has the conditions for a successful pilot, with population density, public transportation infrastructure, allied service providers, potential host sites, and widespread community and municipal support. Supporters include former and current mayors, the vast majority of the city council, and other law enforcement and public health officials, including the head of emergency services in Burlington. Given this preparation, this legislation would fund a pilot project in Burlington, which will be rigorously studied so that we can learn from the pilot. Finally, I want to be clear that the pilot project is not being funded with taxpayer dollars. In fact, the funding comes from the opiates settlement fund, as we put it into the bill. And well, that's money that Vermont receives to address the harms caused by the opioid industry. So, Mr. President, I think what I would like to do at this time is to go through the through the bill, section by section. And I believe you have a copy of the bill in the calendar.
Page 3286 in today's calendar.
I'm still here. So if we look at section 1, this establishes a new statute that sets forth the criteria for an overdose prevention center and provides specific individuals and entities associated with an OPC with criminal and civil immunity, provided the OPC is operating within statutory requirements and Department of Health guidelines. The section is modeled after Vermont's Good Samaritan law, which provides limited immunity from prosecution for a drug violation to a person who in good faith seeks medical assistance for a person experiencing an overdose. So section A lays out the criteria for the OPC, and then section B directs the Department of Health in consultation with stakeholders and health departments of other jurisdictions that have overdose prevention centers to develop operating guidelines for OPCs by September 15, 2024. The operating guidelines must include the level of staff qualifications required for medical safety and treatment and referral support, and require an overdose prevention center to have staff or trained professionals during operating hours who at a minimum can provide basic medical care such as CPR, overdose interventions, first aid, wound care, as well as the ability to perform medical assessments with program participants to determine if there's a need for emergency medical service response. Overdose prevention center staff may include peers, case managers, medical professionals, and medical health counselors. Subsection C in 1842-54 sets forth the immunity provisions for participation in or with an approved overdose prevention center that is acting in the good faith provision of overdose prevention services in accordance with the guidelines established by the Department of Health. The following entities and individuals are eligible for protections. So an individual using the services of an overdose prevention center, a staff member, operator, administrator, director of the center, including healthcare professionals, a manager, employee, or volunteer. Although also protected as a property owner, the leaser, the subleaser of the property at which the overdose prevention center is located and operates, an entity operating the overdose prevention center, and a state or municipal employee acting within the course and scope of the employee's employment. Individuals and entities shall not be cited, arrested, charged, or prosecuted for unlawful possession of a regulated drug in violation of the chapter, or for attempting, aiding, or abetting, or conspiracy to commit a violation of the drug laws. And then subject to property seizure or forfeiture for unlawful possession of a regular drug. So they will not be subject to that. They will not be subject to any civil liability or civil or administrative penalty, including disciplinary action by a professional licensing board, credentialing restriction, contractual liability, or medical staff or other employment action. They will not be denied any right or privilege. The criminal immunity provisions only apply to the use and derivative use of evidence gained as a proximate result of participation in or with the overdose prevention center. Use and derivative use immunity protects the person from prosecution for possession if the basis of the possession charge is evidence of a person's association with an overdose prevention center. This does not prevent a prosecutor from using evidence obtained independently from the association with an overdose prevention center to prosecute the person. And I believe that Senate Judiciary will make comments on this section within their jurisdiction. And they will have a proposed amendment. I believe they have proposed amendment. This doesn't prevent prosecution under federal drug laws. Subsection D is a reporting section, and it requires an OPC to publicly report information on an annual basis regarding the number of participants, the demographic data of information about the participants, the number of overdoses, the number of overdoses reversed, the number of times emergency medical services were contacted, the number of times law enforcement was contacted, and for response, the number of participants directly and informally referred to other services and types of services. Subsection E clarifies that an overdose detection center does not require a certificate of need. Section 1A amends the CON chapter and so to clarify that the OPC does not require a certificate of need. Section 2 is a description of the pilot program and the appropriation of $1.1 million in 2025 to the Department of Health from the Opioid Abatement Special Fund for the purpose of awarding grants to the city of Burlington for establishing an overdose prevention center upon submission of a grant proposal that has been approved by the City of Council of Burlington and meets statutory and guideline requirements. Requires the Department of Health to report quarterly to the Joint Fiscal Committee and the Joint Health Reform Oversight Committee regarding the status of the distribution of grants. Section 3 is a study and directs the Department of Health to contract with a researcher or independent consulting entity with expertise in the field of rural addiction or overdose prevention centers, or both, to study the impact of overdose of the pilot program that we described in Section 2. The study is required to evaluate the current impacts of the overdose crisis in Vermont, as well as any changes for up to 4 years following the implementation of the Overdose Prevention Center pilot program. And then it sets forth many goals, several goals in the study to follow, and that is the current status related to our crisis, the deaths across the state of Vermont, crime rates, syringe litter, emergency medical services response calls, the syringe service program participant uptake, and then the impact of overdose prevention center pilot program on emergency response calls. Finally, it requires the Department of Health to collaborate with a researcher or consultant to provide the General Assembly with interim annual reports on or before January 15th each year, and then a final set of recommendations January 15th, 2029. Section 5 relates to the syringe service programs. This is a organized community-based needle exchange program to strike out limiting language as to who may participate. And one of the things that was of concern to our committee was to have some geographic use and distribution of syringes. So that would allow for that. And then Section 6 talks about amends law to strike out who assists the Department of Health in developing guidelines for the syringe programs. Section 7 is the appropriation for the syringe service programs. And sections 8 and 9 are technical amendments relating to the Good Samaritan law for reporting overdoses. Section 9 designates the statutory section numbers in the bill, so they're technical corrections. The Section 10 is a section that makes the bill effective, or the law effective on passage. Mr. President, we heard from a number of folks in our committee, and I'll go through a few of them. We heard from the Vermont Medical Society. We heard from the Journey to Recovery Community Center, Ledge Council. We heard from the Director of Nursing at the Howard Center in Chittenden County. We heard from the Drug Policy Alliance. We heard from Vermont EMS Advisory Committee Chair. Vermont statewide. We heard from Vermont Overdose Prevention Network, Vermonters for Criminal Justice Reform. We heard from Behavioral Health and Criminal Justice for an expert from Research Triangle Institute in California. We heard from the Joint Fiscal Office, the Commissioner of the Department of Health, the Director of Rutland Dismas House, a Professor of Epidemiology from Brown University at School of Public Health, the current Mayor of the City of Burlington, the former Mayor of the City of Burlington, Scott Havik, the Substance Use Policy Analysis, also of Burlington, and then a harm reduction specialist from the AIDS Project of Vermont. We heard from the House reporter. And we had many letters sent to us from others. One of those letters was a letter signed by more than 500 Vermonters and over 50 organizations across 70 Vermont cities and towns. We also heard from, received 20 letters of support, including from Vermont's public health organizations, physicians, nurses, harm reduction organizations, reproductive rights organizations, firefighters, businesses, and business organizations, as well as people with lived experience. The Vermont Department of Health has told us that the majority of people that die in Vermont use alone, and they caution Vermonters never use alone. They go on to talk about going slow, using clean needles, using test strips, having naloxone on hand, and other ways to prevent someone from overdosing and dying. OPCs align with this life-saving message and embody both the spirit and the practicalities of such efforts. The pilot in H72 gives Vermont another tool in our collective effort to stem the unconscionable loss of life that we have witnessed for over a decade. We have taken our time, we've gone slow, we've allowed the evidence from other countries, cities, and states to guide us. We have examined a lot of peer-reviewed scientific studies that demonstrate that OPCs play a critical role in keeping people alive, giving them one more day to come to a place where they want to change their lives, and then be ready with resources and support to help them make that change. We have seen that these centers work to both save lives in the moment and save lives long-term by providing people with the support, love, and resources they need. There's never been a fatal overdose in the history of an OPC worldwide. We've also seen many of the benefits that communities with reduced drug waste, no increases in criminality associated with OPCs, and the creation of community connections that increase our collective efforts to address this crisis. OPCs, of course, are not the complete solution to this difficult and ever-changing public health crisis, but they play a multidimensional role that, in combination with other public health efforts, will save lives and will help communities. USENA Health and Welfare presents our amended version of H72. The vote in committee was 3-2, and we ask that the Senate support our work. Thank you, Mr. President.
Bill is then referred to Committee on Finance for the report of the Committee on Finance, Senator from Washington.
Mr. President, Senate Finance received this bill because as the bill came from the House, it contained a fee. Health and Welfare removed that fee and replaced it with an appropriation from the opioid settlement. So we determined there would be no impact on the revenues of the state and voted the bill out.
Bill is then referred to Committee on Appropriations for the report of the Committee on Appropriations, Senator from Chittenden Southeast.
Thank you, Mr. President. Appropriations reviewed the bill and we made some changes. So in section 2, we added a subsection that, in the bill, there's funding for 1 year. And so your appropriations committee realizes that a pilot that's going to report back in 2029 might need some funding going forward. So we put as in section 2, C, an intent language that you see in front of you, that it's the intent of the General Assembly to appropriate funds over the next 3 fiscal years for the purpose of awarding grants to the city of Burlington for the pilot program that's here. And then we also struck out section 7 relating to syringe service programs. Much of that language and funding is included in the budget, as we will see. And just to, as a comment about the funding source, the opioid settlement committee or fund. And I want to give credit to the members of my committee who worked so hard on this. In particular, this is not the appropriations amendment, but overall. I just want to say that Senator Hardy was a member of the opioid settlement committee that works on within 5 principles. And I think this is pertinent to what we've done in appropriations. And the first of those principles that the opioid settlement committee works with is spend money to save lives. And so consistent with that, your Senate Committee on Appropriations has indicated an intent to spend money to save lives over the life of this pilot program. And so I did want to say thank you to my committee and the member of the opioid settlement committee in particular for their work. So thank you, Mr. President. That is a report of the Appropriations Committee.
So the question is, shall the report of the Committee on Health and Welfare be amended as offered by the Committee on Appropriations? Are you ready for that question? If so, all those in favor, please indicate by saying aye.
Aye.
Those opposed indicate by saying nay. The ayes have it, and you have amended the report of the Committee on Health and Welfare as offered by the Committee on Appropriations. The senator from Wyndham.
Thank you, Mr. President. I have an amendment to H72 that comes from 3 members of Senate Judiciary, and I see that it's being passed out now. So this is a pretty short amendment. We were asked to look at the immunity section, and what this amendment does is it clarifies part of the immunity provision, specifically for civil immunity. And I believe that general section is located on page 3288 of today's calendar, and the copy of the amendment is being handed out now. So the amendment states that individuals will not have immunity if they were using the services of an OPC and the basis of a lawsuit is that the defendant committed a DUI. So for example, if you're using the services of an OPC and then leave and crash into another car or someone else's property, you may still be liable for things like medical bills, restitution, and so on. The amendment also has a second section which clarifies that immunity will not apply to claims unrelated to the provision of OPC services. This is a catch-all type of provision because there are an endless number of hypothetical scenarios and they each have their own facts. So overall, the purpose of the amendment is to clarify the extent of the immunity provision and ensure that its scope is narrowly tailored to services provided by an OPC. The amendment was discussed in Judiciary and is presented by 3 members of that committee, and I ask for the Senate support.
Senator from Chittenden Southeast.
Thank you, Mr. President. The proposed amendment was presented to us, and it really does reinforce the intent that we had. So we're very supportive of the amendment.
So the question is, Senator from Essex.
Thank you, Mr. President. Can I interrogate the report of the amendment, please, that Judge just presented?
Senator from Wyndham is interrogated as a reporter of the amendment.
Mr. President, when you are served alcohol in an establishment and you leave that premise and you go and you cause any type of harm to somebody else, that establishment can get charged for over serving. Is this any way does this go back to the people that helped administer a dose of a drug that's legal nowhere in the world and went on to cause harm with anybody? Can the facility that was responsible for that be charged?
I think that's a question regarding the underlying bill, but I was specifically reporting this amendment regarding DUIs and anything else that's unrelated to OPCs. So are you asking me if the OPC is immune?
I'm asking, Mr. President, if this amendment right here is going to help keep the OPC from immunity when somebody who is used and leaves there impaired. Is this amendment made to help keep immunity from the OPC?
That's a question for the underlying bill, but I'm happy to take a brief recess and consult with ledge counsel or the reporter of the underlying bill.
I will question, later on this. Thank you. Thank you. I think the reporter.
Question is, shall the report of the Committee on Health and Welfare as amended be further amended as offered by the Senator from Wyndham and others? Are you ready for the question? If so, all those in favor, please indicate by saying aye.
Aye.
Those opposed indicate by saying nay. The ayes have it, and you have further amended the report of the Committee on Health and Welfare. Is there another amendment? Senator from Chittenden.
So still I'm relatively new at this. I do have an amendment, but before I present it, may I inquire of the reporter of the underlying bill?
You may, because the underlying question is, shall the bill be amended as offered by the Committee on Health and Welfare as amended? So that's the current question and conversation. Would you care to inquire?
I
Of the
would.
Senator from Chittenden Southeast is interrogated as the reporter of the bill.
Thank you, Mr. President. So I have some questions and concerns over this bill, and I do want to ask a series of questions in order to substantiate my understanding, also for the benefit of the entire Senate, in context for the amendment I am going to bring forward, whether or not today or at third reading, that's depending on the editors and so on. If I could, Mr. President, could I confirm that during the reporting of the bill, it was stated that New York City has an open OPC, and that Minnesota and Rhode Island have authorized it, but they have not opened an OPC, and that the only open overdose prevention center in the US right now is in New York City.
That's right,
And they opened in 2022, Mr. President?
21.
21, great. I also heard reference to Canada, and I've been reading up on the Canadian safe consumption sites. And I understand that their federal parliament, their Canadian parliament has authorized, or the health service, not the parliament itself, is recognizing and authorizing these safe consumption sites to be managed and regulated through the health service by the provinces. Do we have anything comparable with the federal context of the US, meaning down in DC, does our health department or health overseeing bodies, have they authorized or enabled any such legislation comparable to what Canada has?
No,
So the point that I'm taking from this is that this is uncharted territory for not only Vermont, but the United States, and that we are less aligned with our federal counterparts than Canada is. I have another question just related to this. I read in the bill that I see in the definitions of the bill that an overdose prevention center, number 4 states that an OPC answers questions on safer consumption practices. Will staff and providers give instructions on how to safely use hypodermic needles to use illegal drugs?
yes, they will. That's what currently happens.
So the amendment I'm going to bring forward, which I have exchanged with email with the chair, things move fast around here this time of year. So I certainly want the committee to weigh in on it, be it a recess or come back at third reading. But the amendment I'm going to bring forward is consistent with what I've seen Canada, different provinces have implemented, which would restrict access to these facilities for individuals that are 21 years of age, with some verification to that regard, limiting access to those concerns. I do have 2 other questions unrelated to my amendment. Will I be able to interrogate the reporter again after this?
You could, right now, the pending question, because I don't believe you formally offered the amendment at this time, is shall the bill be amended as offered by the Committee on Health and Welfare as amended? And you can rise 2 times without seeking further permission to either debate or inquire.
I would like to present the amendment, recognizing that we might need a short recess for Pauls to consider it. But could I please pass the amendment out now?
It's actually been handed out because
Great,
there was a
excellent.
presumption that was happening. The question is currently also, are you still inquiring or are you complete?
I would like to cease my inquiring. of the
So you can
reporter
thank
and
the
now
senator.
present this. Thank you, Senator, for your time.
You're all set, Senator from Southeast. He has thanked you. There we go. I thought you might not want to continue standing if you didn't have to. Senator from Chittenden Southeast, you may continue.
Thank you very much. So you all have this, great, excellent. So I do apologize to the committee for not having time to pass this by you. I certainly welcome your consideration of it. My concern with this bill that I have lost sleep over is that it's not in Vermont, there will be kids 16-year-olds, 18-year-olds, 19-year-olds, 20-year-olds experimenting with life and drugs. And they will get their hands on heroin, other drugs, anywhere in Vermont. And with this known overdose prevention center up in Burlington, Vermont, as I read this bill, they would be able to take those drugs, drive to Burlington, Vermont, have the drug tested, which is good. We want to test the drugs. And then possibly get instructions on how to consume an illegal drug using a needle. I worry that that is sending the wrong signal to our youth. I do see in Canada that they do have many provincial SCSs which state clearly with signage outside the doors that those under 21 are not able to access all of the services of this facility. This amendment here is to just make clear that it is the intention of this legislature, as contemplated in the bill, where I don't see anywhere else where it speaks to this, that those under the age of 21 are not intended to be able to get guidance, to consume, or to access the full spectrum of services that these overdose prevention centers would provide. I submit this, this as a modest amendment to just make this bill a little more palatable. And I would welcome either a recess for the committee to consider it, or otherwise it is put forward for the entire Senate to vote on it. Thank you, Mr. President.
Senator from Chittenden Southeast.
Thank you, Mr. President. The immunity provisions and the within the proposal are under the Good Samaritan law, and the Good Samaritan law would not allow for treatment of anyone 21 or younger. So that piece is clear. Then on the other section, I'm looking at this. Our committee, I think, would like to perhaps have a minute to look at this, but as I look at it, you're putting in operating guidelines that have signage and controlled points of entry and all of those things that our Department of Health will be considering and developing as guidelines, and then producing those guidelines by September 15th, 2024. We cannot anticipate what the Department of Health might require, but as part of their work, and in the work that we've done in committee, there will certainly be some connections with best practice in other places. Thank you, Mr. President. So this proposal is something that our committee would very much like to look at, to offer opinion upon. And we could do that over in the corner. I have no idea how long it will take us. Sometimes we have a long discussion, but sometimes it's shorter. So I would ask for a recess so that the committee might consider this. And if we can't come to a decision, we might ask to have it presented to us tomorrow morning. Thank you, Mr. President.
I will declare a brief recess in a moment just for clarification. However, there is a small Scrivener's error in the first instance of amendment. The word "of" prior to the word "older" at the end of that amendment should be "or" as opposed to "of." It's small technicality, but if you're going to be discussing the amendment, I thought I should make sure that's clear ahead of time. With that, I will declare a recess till the fall of the gavel. Senate will please come to order. Senator from Chittenden Southeast.
Thank you, Mr. President. First, I want to offer a correction that the Good Samaritan law does cover people under the age of 21. So I spoke on that and with sincere apologies for misleading anyone. So then we did look at this proposal amendment and as happens in our committee, we have a 3 for and 2 against. And so we are, 3 against and 2 for this proposal amendment. So the committee on a vote of 3 against and 2 for, vote not to accept this proposal of amendment. And just as a comment, the Department of Health will be writing guidelines and will be addressing many of these issues and others. The vote in committee was 3 to 2 against accepting this proposal of amendment.
Current question is, shall the report of the Committee on Health and Welfare as amended be further amended by Senator from Chittenden, Senator from Chittenden Central?
Thank you. May I please inquire of the presenter of the amendment?
Senator from Chittenden Southeast is interrogated as the presenter of the amendment.
Thank you. Do you have any data about how many people under 21 currently use opioids?
I do not.
Okay, so you also probably don't have data about how many people under 21 have died of overdoses.
I do not.
I wonder if you could foresee this as a barrier to these people accessing harm reduction services and potentially causing their death of an overdose.
Mr. President, I see this as a barrier to them learning how to safely consume illegal drugs.
Do you have any data about the constitutionality of barring a class of people, those under 21, from accessing a certain healthcare service?
I do not.
Wonderful. I thank the senator. I think it is very uncomfortable to consider young people using drugs, but the reality is they are. And I think it's more uncomfortable to consider them dying of overdoses because we bar them from access to treatment. Thank you.
Senator from Franklin.
Thank you, Mr. President. May I inquire of the chair of Health and Welfare?
Senator from Chittenden Southeast is interrogated if they so choose.
Thank you, Mr. President. I'm wondering, based on the vote on the amendment offered by the senator from Chittenden Southeast, would that mean, without that amendment, that an individual 17 years of age could enter a facility of this type and not just receive instructions, but receive the ability or receive assistance with the ability to inject a drug?
Right now, yes, Mr. President, but it will of course depend on the guidelines that the Department of Health writes and how that 17-year-old is handled and what services are offered to the 17-year-old.
And so we do not know then, Mr. President, what will be written and how the law will be implemented in the event that it's passed.
Mr. President, we don't know what the Department of Health guidelines might be, but they will more than likely be consistent with the work that's being done in over 200 overdose protection centers across the globe.
Does the senator know whether or not there are similar situations that exist for those overdose prevention facilities that exist in the United States?
In New York City, yes, it would be allowed.
And would the ability to inject drugs by a 14-year-old be allowed?
I would think so. I haven't heard the age range for those folks who have accessed services and prevented death in New York, but I would think so.
How about a 6-year-old?
Mr. President, I find it highly unusual for a 6-year-old to walk into a center with a needle and drugs and ask to have the drugs tested and to have help injecting. I find that an impossible question to answer.
But I assume then, based on the earlier answers, Mr. President, that that would not be the case with a 14-year-old who could perhaps do that.
Yes, Mr. President, that's right.
Thank you, Mr. President.
Senator from Essex.
Yes, Mr. President, thank you very much. Could I inquire of the presenter of the underlying bill?
The reporter of the bill is interrogated.
It should come to no surprise about what my question would be, Mr. President. I'm just very concerned that you have situations in the state where somebody is overserved in a bar and they leave and they cause harm to somebody else, that they would be the place where they left would be responsible, could be charged. And in this instance here, could this be in the same way? If somebody has been consumed drugs and had helped to consume an illegal substance, and they went on to cause harm, it would the place that was responsible be held liable.
Mr. President, there are two separate things. So the immunity protection is offered to the folks who are at the OPC. If an individual is under the influence outside and causes harm, that individual will be held responsible for that harm. And if you need more in-depth information or how it might relate to the use of alcohol in a bar and a bartender, that's something that Ledge Counsel will have to help with, or someone from Judiciary.
Mr. President, it's not where I wanted to go with it. I just wanted to know, as this bill was being in the committee and discussed in the committee, is there going to be liability with the OPC as somebody's using in that facility? I mean, I know also, an argument when we were offline, an argument was being made that, well, they were bringing their own substance with them, but the same can be said with somebody who's having a dance hall. That's bring your own booze. If somebody was to consume too much and leave that premise, the person that had the gathering is going to be held responsible should the people that left there go out and create harm. In this instance, in the same instance that we're talking about, if somebody uses this illegal drug that's nowhere legal in the world, if they leave this facility and cause harm, will the facility be held responsible, just like the rest of the state of Vermont? Would they be held responsible for the actions that were caused by the person leaving the facility?
Thank you, Mr. President. I can understand the concerns that are being expressed, but I'd like to put it into a context of what's actually happening and what's in the facility itself. So when you walk into a OPC, it's very clean. It's clinic-like. It's bright lights. There are little booths and sections.
Point of
for
order,
folks.
Mr. President. What amendment are we on? I'm confused.
That is a good question. The point of order is well taken, because the debate right now should be about the amendment being offered by Senator Chittenden. And it does appear as though the questions are about the underlying report that the committee has amended. So if the senator would care to discuss perhaps the question specific to the amendment, that's completely appropriate. Thanks.
Thank you.
I'll start over in a little bit, Mr. President. Thank you very much.
The question is, shall the report of the Committee on Health and Welfare be further from Washington?
Thank you. Thank you, Mr. President. I was on Health and Welfare when we discussed this same program a number of years ago, maybe 5, 6, maybe 7. And my understanding, whether we like it or not, we have children who are addicted to drugs. The purpose of this is not to teach them. When you walk in, there's people there. Their job is, when you're in this vulnerable moment and you're shooting up, they're there with information to help you, to tell you what's available, to help you kick this habit. I cannot fathom the thought that a 14-year-old would walk in and say, I've never shot up before, but I want you to show me how to do it. I think they would get referred very quickly. Maybe their parents would get called. That's not what this is for. And this is kind of a red herring. I mean, something bad could happen. But I know people who have lost children to drug overdoses, who have lost family members and parents and, fathers and mothers. This is to make sure that there is somebody there who can administer the appropriate medical, Narcan, CPR, so that you have a chance of survival. And then maybe that scares you enough this time. They're there with the information on, okay, if you don't want this to happen again, these are the programs that are available to you. It's not, the purpose of this is not to start children on a habit, but it is to help the children who already have a habit to make sure they don't die before they can reach the stage of getting the help they need.
Question is, shall the report of the Committee on Health and Welfare as amended be further amended as offered by the senator from Chittenden? Chittenden Southeast, excuse me, the name thing. Are you ready for the question? If so, all those in favor, please indicate by saying aye.
Aye.
Those opposed indicate by saying nay.
No.
The nays appear to have it. The nays do have it, and you have not further amended the bill. The report, excuse me, Senator from Chittenden Southeast.
I have 2 more questions, if I may.
I'm assuming interrogate the reporter. Senator from Chittenden Southeast is interrogated as the reporter of the bill.
So as I said, I've lost a lot of sleep on this. I did hear that you did have testimony from fire and EMS professionals. This weekend, I reached out to some friends in law enforcement, and the responses I got were vehemently opposed. And then I quickly received an email from the chair of the Police Chiefs Association, and they also do not support this. My question is, did our Senate Committee on Health and Welfare take testimony from any law enforcement agencies here in the great state of Vermont?
No, we did not take agency testimony, but we did allow for anyone who requested to come in and testify. We heard from our first responders. We also heard from the Law Enforcement Action Partnership, and that's a national group that includes folks from Vermont, including Kim Cheney and Annie Romanescu. So we had a letter of support from them. And then we also heard from Fair and Just Prosecution. It's also a national group with presence in the state. And that's a national group of prosecutors supporting system reforms, and they submitted a letter supporting the bill.
Just to be clear, I didn't hear any Vermont law enforcement did testify to your committee.
No, they did not. When we heard testimony from former Mayor Weinberg and also current mayor, we heard from Burlington, there were full support and that they would be working with their public safety folks during the development of the pilot program.
Thank you, Mr. President. Last question I have for the reporter, and I do appreciate all of her good work on all sorts of bills. My big concern for this is that Burlington, Vermont is still very rural compared to the large municipalities that have this in place. The example of Grand Prairie of 90,000 people up in Canada is near, I understand, an oil drilling facility and has been deemed one of the most dangerous places in Canada. My question to the chair, to the senator, if I may, the reporter of the bill, did your committee consider alternative resources to address this crisis, like standing up, promoting, supporting with counselors, a never use alone hotline so that Vermonters, including kids, all over the state, from wherever they are, can call in, describe what they're going to do, stay on the phone with them while they use the drugs. And that way, if something doesn't, excuse me, Mr. President, and if they stop being responsive, they could initiate emergency phone calls. Was that an alternative considered by your committee?
Mr. President, we did not consider that alternative. We do have a number of hotlines in our state, not the least of which is 988 for suicide prevention. We also have other hotlines, as you know, 911, 211. We have the Pathways line that stays open for folks. Would be a terrific tool in the toolbox. We did not consider that this time as a separate opportunity. We have worked this year very hard and looking at recovery programs and investing in recovery programs, peer support counselors, peer recovery support counselors. So building a system of care, and in many ways, we're starting at this level. But I would welcome an introduction of legislation that we could consider on a hotline that might be accessible to kids and others.
Thank you. I thank the senator. The last comment I'll make before I sit down and stop talking is what I have heard that argument on this bill, that this is another tool for the toolbox. There are different toolboxes. I don't think Vermont's toolbox is ready for this tool, because different tools require different supports, different safety procedures, different mechanisms to make sure everybody knows how to use the tool and to make sure the tool is used safely. So I will be voting no on this bill because I don't think Vermont's ready for this tool. Thank you, Mr. President.
Senator from Madison.
Thank you, Mr. President. First, I want to express my sincere, and I mean this, my sincere empathy with the senator from Chittenden Southeast, and now I'm going to start crying. It's kind of catching. I think I would assume that most of us in this room, in some way or another, have been impacted by this crisis, by this epidemic. Last fall, I taught a class at Middlebury College, and on the second week of the semester, one of my students in my class died of an overdose, and she died alone. And she was under the age of 21. And had she had a place where she could have felt safe to go and use with someone else, she might not have died. So I think that I know this is really incredibly emotional and hard for so many of us in the chamber. I am the Senate's representative on the Opioid Settlement Advisory Committee. And this is a topic that we have discussed at length for the entire time that I've been on the Opioid Settlement Advisory Committee. And I know that there are members of that committee who are here with us today, and one in particular witness to that committee who spent every single committee time with us, who's watching from the balcony. We took a lot of testimony in the Opioid Settlement Advisory Committee on overdose prevention sites. We considered every angle you can think of. And many members visited sites, and I know that members of the Senate also have visited sites in other states to see how they're run. We looked at a lot of data. We had presentations from people in Canada, from people in New York and Rhode Island, and we heard from extensive experts on this topic. We also did consider other options, and I really appreciate the suggestion that was just made about the hotline. In fact, there is a national hotline called Never Use Alone that is available to Vermonters. And in fact, there's an amazing podcast that actually goes through how that Never Use Alone site works, and actually has a Vermont connection to somebody who lives in Southern Vermont. And I'm happy to share a link to that podcast with anybody who is interested. So there is that resource that already exists in Vermont, and our Department of Health provides information in their overdose prevention kits about how to use that overdose hotline. So that is a resource that is already available in Vermont, along with a lot of other resources. And I, as somebody who's not from Burlington and who's worked very strongly very heavily on this topic, has advocated repeatedly that we cannot make this just about Burlington. It can't just be a resource that's available in Burlington. And it needs to be a resource, there need to be resources of equivalent efficacy available throughout the state. And I advocated strongly that we increase our funding for our syringe service providers, and worked with my colleague on the Appropriations Committee and to make sure that that funding was available so that people in other rural parts of the state have access to similar types, if not exactly the same, but similar types of services. That being said, our concentrated population is most concentrated in Burlington, and Burlington has done so much of the groundwork to make sure that the path is cleared for this type of service. And they have law enforcement on board. They have the prosecutor's office on board. They have the medical establishment on board. They have the political establishment on board. They have the community on board. They are ready, willing, and able to do this. And they will save lives if this happens. They will save lives in Burlington if this happens. And some of those lives might be under 21. And I hope that they do save those lives, because those are people like my student who are using because they have a disease and because they are alone. And I want them to not use alone. So I just want, first of all, to make sure everybody knows we have a comprehensive system in Vermont, and we have done a lot in the last couple of years. We passed a bill on this floor just a year ago that expanded our services throughout the state, including in our rural areas. And yes, I know that this is another tool in our toolbox. Saying is kind of cliche and slightly annoying, but it really is just another thing we can do in Vermont to save lives. And those lives will be in Burlington, but those are lives that we should save with a facility like this. It's not a training program. It's a support program that helps to save lives. It's a harm reduction program that will save lives, and it is well worth doing. So I thank you, Mr. President, and I hope that the body supports this. It's really important legislation, and we're ready for it now. Thank you.
Senator from Rutland.
Thank you, Mr. President. May I interrogate the reporter of the underlying bill?
The senator from Chittenden Southeast is interrogated as a reporter of the bill.
I wonder if the reporter could characterize the Commissioner of Health and his outlook on this bill.
Mr. President, we heard a long testimony, a lot of testimony from the Commissioner of Health. And his comments were, it is not really appropriate for a rural environment because you need to have a density of population and folks who can access this kind of facility. And as he talked about a couple of things, but one of the things he did indicate is that if it were going to happen anywhere in Vermont, it would be in Burlington, where there is a high population density and where we have a known problem with drug addiction.
So if I were to summarize, Dr. Levine was not necessarily 100% favor of the bill. Would that be correct?
He did not say whether he supported or did not support the bill. He simply offered his testimony and indicated that this kind of facility may not work in an area without significant transportation infrastructure, without support services available and nearby, but that if there were going to be a place where it could happen in Vermont, it would be in Burlington. And then he did comment additionally, and I can't remember exactly what he said, what he wrote, but or said, but there might be opportunities for mobile services. So, but overall, he did not say that he was for or against the bill. He simply said that rural areas don't well support this type of facility for the reasons I suggested, some of which are the services that are nearby, and including EMS or hospital or clinics or mental health or other social services. Those things need to be available, and then transportation needs to be available so that people are not held to going out to driving. And so that's what he said. When he mentioned that Burlington has a population density that could support it, and that Burlington has voted at their council level to support this. I think that was the opportunity that we took to put in place the Burlington pilot program, as it seems to fit with what we have in our state.
Thank you, Mr. President. Would the reporter also agree that that was pretty much the same testimony the Vermont Medical Society gave, that they were not necessarily opposed to the bill, but not necessarily in favor of it?
The Medical Society was supportive of having a pilot program, and in particular in Burlington.
Thank you, Mr. President. And just for clarity's sake, while the current administration in Washington has not actively prosecuted overdose prevention sites, the fact remains that these facilities are still prohibited by federal law. Is that not correct?
That's true.
Thank you, Mr. President. You spoke about the Burlington proposed site, and I'm referencing page 3288 in the calendar today. And as you indicated, the grant proposal has been approved by the Burlington City Council. Did that vote occur after a public vote with all the residents of the city of Burlington, or was it strictly a vote by the Burlington City Council?
As far as I know, it was a city council vote. There's also, that's all I know.
Okay. Are there opt-in and opt-out provisions in the bill for communities?
So for a community to accept a grant, any municipality that accepts a grant, the grant needs to be supported by the legislative body. So with any grant, whether it's Burlington or Brattleboro or anywhere else, it would have to be some support coming from the city council or the select board.
I thank the Senator. I just have one more question, and I know there are others that wish to speak, and I want to kind of go back to some earlier questions. If an individual uses the site and injects a particular drug and then gets in a vehicle and drives and is involved in a fatal accident, where and who could be found responsible? Because by extension, as I understand it, even though the funding for this is coming from the Opioid Settlement Advisory Fund, by extension, I think that puts the state on the hook as well to some degree. Is that true? And we talked earlier when the senator from the Wyndham district talked about civil penalties, but what if it rose to a criminal penalty? Could the state not be held to be responsible in some way?
Well, so what we learned is that the state involvement with an OPC is much less than licensing or inspection. It's just funding and guidelines. So the sovereign immunity would apply.
I thank the senator. Thank you, Mr. President.
Senator from Chittenden Central.
Thank you, Mr. President. This bill has been a long time coming to this chamber, as has my support for this bill. I started out some years ago not supporting the bill, and I didn't support the bill in ignorance, honestly. I didn't support it for prejudices that I was bringing with me without necessarily realizing. I will say, over the last 2 or 3 years, I have done my best to try to educate myself about what these centers are, what they offer, what they are and are not. So I want to just talk for a minute about, I think in this chamber, we are always concerned about our constituents. And that is why we're here. We're to protect the people who sent us here, not only to do their business, but to protect them, their lives, the lives of their family. So I think when one considers it quickly, there can be a tendency to say, on the one hand, we will save the lives of people who are addicted, but on the other, will the community suffer? So public safety on the one side, hit it against harm reduction. I no longer see it that way. And I don't believe that the people who are bringing us this bill see it that way either, based on the vast amounts of testimony that they've taken. What OPCs do, the data tells us, is not only do they save the lives of people who use them, but they improve the lives in the surrounding community. So I wanted to make sure on this particular point. So I met with researchers from Brown University who are part of the attempt there to open an OPC in Rhode Island. And they are doing meta research on this topic from around the world. They are perhaps the most knowledgeable people in the world, certainly in the United States, in my opinion, on this topic. And I asked them specifically, can you say definitively that public safety is improved in the places where these sites go in? They said yes. And they offered me several indicators. First of all, needles, medical waste drops dramatically. Now, that is important to me, particularly as somebody who comes from Burlington, because as my colleagues in this row will tell you, we have not just a problem, but a crisis in the Burlington area, people trying to use public parks, worried that their children will step on a needle, bringing all the repercussions that would come with that. So we now have people, volunteer groups, who go out into the parks and pick up needles. We shouldn't be doing that in the state of Vermont. And according to these researchers, if we open one of these centers, that waste will drop dramatically. What else drops dramatically? Not only the deaths of users, but calls to first responders, calls to our police departments. So those communities stop being places where people are calling because they see folks using in the bushes on the fringe of the public library. They stop being places where parks see open drug use because there is a safe place for those people to use. So I will say this, I have changed from somebody who was reluctant to a very strong supporter. My community, Burlington, Vermont, not only wants this, they need it. They are not asking us, they are begging us. Save those lives, improve the lives of the people around that, address public safety through this measure. Thank you very much.
The question is, shall Senator from Essex?
I apologize. I know it's probably an unwritten rule to speak after the pro tem, and I do apologize about that, but this is very important to me. I can't believe that this is the best that we can come up with to combat opioid deaths. To allow a safe zone to inject oneself with drugs that are legal nowhere in the world, it's unbelievable to me. And not only to me, I've yet to find anybody outside of this building that supports such a law. And I do travel around. I put on 45,000 miles a year and the subject comes up. I talk with drug recovery people, many of them. In my life that I don't brag about, I help a lot of people. I bring a lot of people to rehab. I pick a lot of people up from rehab. And I probably do as much about that privately as anybody that you're ever gonna find. And it isn't about keeping them using, it's about getting them clean. And this bill doesn't do anything about that. This just isn't the direction that we ought to go. And I feel like after talking to many people in the drug recovery business, that they feel the same way. They feel when you talk to anybody in the drug recovery business, some of them probably have been silenced about this in fear of losing funding sources and such. But nobody in that business believes that this is the way that it should go. I Googled the subject many times and I found no successes anywhere in the world that these programs have been found. It's been nothing but a carnage. Drug sales increase anywhere such programs have opened, and why wouldn't they? When you have dealers that want to sell drugs to people who use, what a better place to go than to go to a site that's dedicated to using illegal drugs. It's just a free-for-all. Probably only time I ever in my life would agree with Gavin Newsom the governor of California. When this law was passed in California, he promptly vetoed it. I'm hoping that if this bill passes today, that our governor will do the same. Thank you, Mr. President.
Senator from Chittenden Southeast.
Mr. President, I cannot resist standing and just offering a few pieces of data. In a recent article published by the person referenced by the pro tem from Brown, when these centers are open and an individual begins to use them on a weekly basis, mortality decreased by 54%, all variables held constant. That means 54% life-saving. In another study, after 2 years of use, now remember, this is a pilot program for several years. After 2 years of use, 42% of the folks who accessed the facility went and sought services to get off of addiction. 42%, it's a lot. And then finally, overdose after 12 months, overdoses when facilities are used were decreased by 67%. Abscesses, horrible infections that drug users get, abscesses decreased by 79%, and emergency department visits decreased by 59%. So there is hope here for helping people, reducing harm, and saving lives. Thank you, Mr. President.
Senator from Chittenden Central.
Thank you, Mr. President. There are over 200 overdose prevention centers around the world. The first was established in Switzerland in 1986. And some countries have leaned even further into the understanding that substance use disorder is a public health issue and not a criminal issue. Dozens of countries have decriminalized drugs. Some countries have moved forward with legal pathways towards the use of drugs. And yes, there is only one overdose prevention center here in the United States that operates 2 sites. And yes, they've only operated for a little over 2 years. However, there is a vast body of evidence spanning decades that overdose prevention centers work. The Overdose Prevention Center in New York is following those around the world. They have saved hundreds of lives and millions of dollars while referring 75% of their participants to additional treatment and health services. This important harm reduction policy is something I've been working on since I was in graduate school. Opioid use is a public health emergency, and it requires a public health response. This is the common sense, evidence-based public health policy that this crisis demands. This policy will save lives. I cast my vote today in recognition of the over 1,500 Vermonters that have died to overdoses, for their families, neighbors, and loved ones, and for every Vermonter in danger of a deadly overdose, because their lives matter. Thank you.
Senator from Orange.
Mr. President, my seatmate from down in finance said, we're not ready to deal with this. And I understand exactly what he feels. Many of us in our life find ourselves having to deal with things that we're not ready to deal with. That's the way it is. And the test of our faith in one another and our systems is that when we're not ready to deal with something that must be dealt with, we have the courage and the trust to do our best to deal with it when it happens to us. And this is one of those times. And when we finish voting here today, we will have attempted to deal with something that we're not ready to deal with, either by tackling it or by putting it off until we're ready to deal with it. But it's not going away, and it's not going to be any more comfortable. And the people that elected us ask us all the time to deal with things that we're not ready to deal with. Thank you, Mr. President.
Question is, shall the bill be amended as offered by the Committee on Health and Welfare as amended?
Roll call.
Roll call has been requested. Senator from Chittenden Southeast. Are you ready for the question? If so, the secretary shall commence to call the roll.
Senator Baruch,
Yes.
Senator Bray,
Yes.
Senator Brock,
No.
Senator Campion,
Yes.
Senator Chittenden,
No.
Senator Clarkson.
Yes.
Senator Collmore,
No.
Senator Cummings,
Yes.
Senator Dooley,
Yes.
Senator Hardy,
Yes.
Senator Harrison,
Yes.
Senator Hashim,
Yes.
Senator Ingalls,
No.
Senator Kitchell, Senator Lyons,
Yes.
Senator McDonald,
Yes.
Senator McCormick,
Yes.
Senator Norris,
No.
Senator Pershing,
Yes.
Senator Ron Hinsdale,
Yes.
Senator Sears,
Yes.
Senator Starr,
No.
Senator Yuhoski,
Yes.
Senator Watson,
Yes.
Senator Weeks,
No.
Senator Westman,
Yes.
Senator White,
Yes.
Senator Williams,
No.
Senator Renner,
Yes.
Please listen to the results of your vote. Those voting yea, 21, those voting nay, 8. And you have amended the bill as offered by the Committee on Health and Welfare as amended. Question now is, shall the bill be read a third time? Are you ready for that question? Roll call has been requested by the Senior Senator from Bennington. Are you ready for the question? If so, all those, excuse me, Secretary shall commence to call the roll.
Senator Baruch,
Yes.
Senator Bray.
Yes.
Senator Brock,
No.
Senator Camp.
Yes.
Senator Chittenden.
No.
Senator Clarkson,
Yes.
Senator Collmore,
No.
Senator Cummings,
Yes.
Senator Dooley,
Yes.
Senator Hardy,
Yes.
Senator Harrison,
Yes.
Senator Hashim,
Yes.
Senator Ingalls.
No.
Senator Kitchell,
Yes.
Senator Lyons,
Yes.
Senator McDonald,
Yes.
Senator McCormick,
Yes.
Senator Norris,
No.
Senator Pershing,
Yes.
Senator Ron Hinsdale,
Yes.
Senator Sears,
Yes.
Senator Starr,
No.
Senator Yuhoski,
Yes.
Senator Watson,
Yes.
Senator Weeks,
No.
Senator Westman,
Yes.
Senator White,
Yes.
Senator Williams,
No.
Senator Renner,
Yes.
Please listen to the results of your vote. Those voting yea, 21, those voting nay, 8. And you have ordered third reading of H 72. We now have up for business orders H 173. H 173 was read for the first time and was referred to the Committee on Judiciary, which considered the same and recommends that when the bill is amended, the bill ought to pass. Please listen to the second reading of the bill.
H 173, an act relating to prohibiting manipulating a child for the purpose of sexual contact.
Now you've heard the second reading of the bill. For the report of the Committee on Judiciary, the Senator from Bennington.
There is a connection, by the way. The reason I asked for a second roll call, even if I didn't like the bill that we just voted on, the first roll call was on the amendment, which I thought was much improved over the House version. So I would have voted for it. But I voted for both anyway. But H 173 is an act prohibiting and manipulating a child for the purpose of sexual contact. And when we got the bill, began looking at it, and became concerned with one of the findings, and became concerned with the lack of clarity. And we all know that grooming goes on. That we've heard a number of cases where educators, priests you name it, counselors, whomever, groom children, come close to their families for the purposes of sexual contact with the child. There's no question that that is abhorrent behavior. On the other hand, there are those who may find themselves going out of their way to help a particular child for whatever reason. Could be a big brother relationship, could be a relationship of various different types. And I can remember in my lifetime and connecting to the prior bill, a young man I called Vern, I may have spoken to him before, about him on the floor. Vern and I became very close, and I became close with his mother, working through problems. Fortunately, Vern died of a heroin overdose alone in an apartment at about age 19. So anyway, the bill, as you see, we changed on page 3292. We changed to the first instance amendment is legislative finding. And that is from what the House had as purpose of the bill. There was also another section that I think the Committee on Judiciary was quite surprised at, that we recommended taking out. And you can see that on the on line 16 of the handout as passed by the House version. I'm not sure what the point of that particular statement was, but your Committee on Judiciary felt strongly that it didn't belong in the bill. Finally, Mr. President, we would amend the bill to add after the word community with intent. And the idea there is to make clear that if the person is grooming the child with the intent to have sexual relations with the child, that's what's against the law. It's not against the law to have a big brother, big sister type relationship with a child. Matter of fact, that's a positive thing. So with that, Mr. President, the rest of the bill, we keep the same as in the House version, which is the heart of the bill, which goes at the actual grooming and set standards. We heard from a number of individuals about the importance of this bill. And I would just say, with all of the work that your Senate Judiciary Committee has done over the years on statute of limitations and other issues, that this is an important piece to add to the, I hate to use the word toolbox, but to add to our efforts to prevent child abuse, child sexual abuse. Thank you, Mr. President.
Question is, shall the Senate adopt the report of the Committee on Judiciary? Are you ready for the question? If so, all those in favor, please indicate by saying aye.
Aye.
Those opposed indicate by saying nay. The ayes have it, and you've adopted the report on Judiciary. The question now is, shall the bill be read a third time? Are you ready for that question? If so, all those in favor, please indicate by saying aye.
Aye.
Those opposed indicate by saying nay. The ayes have it, and you've ordered third reading of H 173. We now have up for consideration H 655. H 655 was read for the first time and was referred to Committee on Judiciary, which recommends that when the bill is amended, the bill ought to pass. Please listen to the second reading of the bill.
H 655, an act relating to qualifying offenses for sealing criminal history records and access to sealed criminal history records.
I've heard the second reading of the bill for the report of the Committee on Judiciary, the Senator from Bennington.
Thank you, Mr. President. The House did a terrific job on this bill. But law enforcement and other groups didn't like what they did. The Senate Judiciary Committee spent a great deal of time on the bill, trying to work through what has been a perennial problem, and that is This is a bill about sealing or expungement of certain criminal records. And how do we do this in the state where we've done a hodgepodge of expungement legislation over the years? And it's still at the same time, get a bill the governor will sign. The Committee on Judiciary spent hours mulling over possibilities, listening to testimony. And once again, we were at that place that we normally get. How do you be acceptable to law enforcement who want unlimited access on the street to criminal histories that have been expunged or sealed? If you know, this is maybe after 10 years, 20 years, 30 years. We kept asking, what is the purpose of those records after all that time? And we kept getting the same answer, because we need the information. It was clear that whatever we did would probably not make it through to the final bill signing ceremony. So, taking from what the Senator from Lamoille has taught me many times, when we don't know what else to do, we study. And here we go again. But what we're asking this time is for the Legislative Oversight Committee to look at other states and how they seal their records and what access is provided to law enforcement. Maybe what we've been trying to do here in Vermont is reinvent the wheel that's already been invented. And it just may be that Pennsylvania or Alabama has figured out how to do it right. And we should take the time to look at that. So that's section 1 of the bill. Section 2 was from the House version, which asks the Chief Superior Judge, along with the Attorney General, Department of State Attorneys and Sheriffs, and Office of Defender General and Department of Corrections, to look at how you could do petitionless sealing. In other words, sealing of records without the person coming forward asking for them to be sealed. Mr. President, that's pretty much the heart of the bill. I go over all of our witnesses, but I don't think it does any good, because, you know, it was varied responses, varied looks at it, and I am really disappointed that we couldn't come forward with a good sealing and expungement bill. But we haven't given up the ship yet. And we hope, I believe the vote was 5-0 in committee, and we hope that the Senate will concur with what we've done. Thank you, Mr. President.
Question is, shall the Senate adopt the report of Committee on Judiciary on H655? Are you ready for the question? If so, all those in favor, please indicate by saying aye.
Aye.
Those opposed indicate by saying nay. The ayes have it. And you have adopted the report of the Committee on Judiciary. The question now is, shall the bill be read a third time? Are you ready for that question? If so, all those in favor, please indicate by saying aye.
Aye.
Those opposed indicate by saying nay. The ayes have it, and you've ordered third reading of H655. Senator from Chittenden.
Thank you, Mr. President. As with yesterday, we had looked at 3 as a stopping point. I think it's wise to stop now. So before I make my motion, I will ask senators who are chairs of committees to look at their email. There is an email to you suggesting alternate floor times for tomorrow and the next day to give us more time to get our work done. So if you could take a look at those, and if there's any problem, let us know. Otherwise, I will be very soon sending to all 30 senators a modified schedule to allow us more floor time. With that said, Mr. President, pending announcements, I would move that the Senate stand in adjournment until Thursday, May 2nd at 1 p.m. Actually, Mr. President, if I might amend that,
It's all yours still. Continue
To,
to amend and motion away.
I believe what I would like to do is have the Senate adjourn until tomorrow at 11 a.m. And if there is a problem with that, at least we will be able to defer to the 1 p.m. time. But if I adjourn until 1 p.m. and we decide on 11, we will not be able to come back. So thinking ever ahead, I would suggest we adjourn until 11 tomorrow, Mr. President.
Before I restate the motion, are there any announcements? Senator from Chittenden Southeast.
Thank you, Mr. President. Anticipating that that may indeed occur in terms of tomorrow's schedule, Senate Economic Development will meet tomorrow at 8:30 a.m.
Senator from Washington.
Thank you, Mr. President. Senate Finance will meet at 3. Please be on time because we have witnesses booked until after 6 o'clock.
Senator from Madison.
Members of Senate Natural Resources and Energy could stop by the committee on their way to their afternoon meeting. A brief update on schedule. Thank you.
The other senator from Madison.
Thank you, Mr. President. The Senate Government Operations Committee will meet in about 15 minutes after the call of the gavel. Thank you.
Senator from Bennington.
Thank you, Mr. President. Senate Education will meet 15 minutes after the call together.
Senator from Windsor.
May I inquire of the pro tem, please?
If the senator from Chittenden Central so chooses.
I do so choose.
11 a.m. Are we planning on doing our caucus of the whole on H687 at that hour? Or are we planning on still doing that at 12 or 12:15?
I believe 12:30 is when we plan for the caucus of the whole. So the idea would be to come here, and this is subject to confirmation after hearing from chairs. But the idea would be for us to come here for an hour, 11 to 12. People would have 30 minutes to eat lunch, then come back for a caucus of the whole, and then we would gavel back in at 1 o'clock.
Okay.
Are there any further announcements? By way of announcement on behalf of the Committee on Committees, which we have many ways of meeting, and we did meet this morning. A message has been returned from the House with respects to H546, an act relating to administrative and policy changes to tax laws, requesting a committee of conference. With that in mind, the Committee on Committees appoints the following to that committee of conference: Senators Cummings, McDonald, and Chittenden. Are there any further announcements? Seeing none, the senator from Chittenden Central has moved that the Senate now stand adjournment until Thursday, May 2nd at 11 a.m. Are you ready for the question? If so, all those in favor, please indicate by saying aye.
Aye.
Those opposed indicate by saying nay.
My apologies, Mr. President.
The ayes have it, and the Senate will stand adjournment until Thursday, May 2nd at 11 a.m.